That is the promise of PrEP in 2025. Welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. And I know we've talked about PrEP before on this show, but it is important to keep talking about it because it's a game changer. And Dr. Anu, our medical expert, is here. Hey.
Hi, how are you doing?
I'm doing well. This is exciting, right? You know, we've talked about PrEP before here at Plus Talk. But for anyone who is still unsure, who hasn't seen, or who thinks, nah, I'm not at risk, tell us about PrEP and how it helps prevent HIV.
Yeah, so PrEP, let's see what it stands for, pre-exposure prophylaxis. So just like birth control, it's to prevent HIV. So it's effective by about over 90%, 99% if you take it in the correct manner.
Yes.
And I would say that it's a regimen where, you know, you build up and you take the medications enough that it prevents the HIV virus from taking hold of your body.
Got
in
it.
essence.
In a nutshell. And we've covered the daily pill in the past, but prevention has evolved. What are some of the new options now, including this long-acting shot that can protect you for 6 months?
Yeah, isn't this great? I find it to be very promising. I find it to be exciting that we're still continuing to do research on this and implementing regimens that are sustainable and different options that are out there. The daily pill regimen, it's great. It's been shown to be effective, but the injectables, you know, there's a couple of different forms out there. One, you can take a couple, like, you know, go to your doctor, have your shots every 2 months, but the newest one is every 6 months. I would have to say that initially there is an oral loading dose. You know, you have to take it orally and then convert to the injectables. I think it's a great option. But it depends on what fits for you.
Well, speaking of what fits for you, so we've got the daily pill, we've got a shot every couple of months, now maybe just twice a year.
Yeah.
What factors like lifestyle or routine or comfort or even whether you're housed safely should be considerations?
I think all of them should, right? Whatever fits for you. So it depends on what you're going to stick to. It depends, I would say, on what your insurance also covers, how accessible it is. I mean, we got to be real about that, right?
Yeah.
The costs of it, and then just being able to have access to the medications and your regimen, like whatever you decide. And that's something that you and your provider should be able to talk about.
And you know, look, even after all the times we've covered PrEP on Plus Talk, stigma and myths are still out there. What's one misconception, one myth about PrEP you'd like to bust today?
Is that PrEP is only for certain types of people.
Gay men.
Yes.
Basically.
Or people that have multiple sexual partners.
I see, right.
And they do not like this.
Yeah.
You know, it is for anybody and everybody that deems it fit and appropriate to protect their sexual health and their health.
And I know access, you touched on this a minute ago, it's still a challenge in some places. What do people know about how to actually get PrEP these days?
I wouldn't really know. I don't really know what they know, right? As far as my patients are concerned, start with just talking to your provider about it or looking online for resources. I think there's HIV.gov, you know, Find Your PrEP. Like there's multiple websites that are out there. Reach out to your community group. I think there's different options on how to acquire PrEP, right? You don't have to go to an HIV-centered clinic.
Right.
Now primary care providers are able to
Well,
provide
you could do
that.
it and online too.
Services.
Yeah, there's
like it's there and accessible. It's just finding the means to do it.
and that fits you and your lifestyle
Correct.
and your budget too.
Yeah.
How important is it that we keep having this conversation? Because I guess, you know, people forget or they assume that PrEP isn't for them or they don't need it.
Yeah, I think it's very, very important. Someone who wasn't ready for it maybe 2 years ago may be ready for it now. There's still people out there that don't know about PrEP. And I think that it's just as important to repeat it. We keep repeating seatbelt safety. We talk about vaccines. We talk about contraception. Why can't we continue to talk about PrEP?
Yeah. Well, stigma plays a role in that sometimes. For anyone who's sitting on the fence maybe and thinks, well, maybe, but maybe I shouldn't. Maybe they've heard us now talking about PrEP, but they still haven't started. What's your message for them?
Don't wait until your body is broken. You have a chance to prevent it from doing so.
That's good advice.
And PrEP is not there to make you ashamed. It's to create freedom.
Yeah.
freedom for your sexual health, and that's the way that I look at it, right? And preventing, and you have a powerful tool in your hands. So, get the information that you need. It's all around you. Have an open conversation. Answering all of your questions regarding PrEP, and see what's the right regimen for you.
Yeah, I mean, it is another really effective tool in the toolbox for your own sexual health and to take care of your sexual partners around you as well.
Yeah.
Taking responsibility. From daily pills to maybe just 2 visits to the doctor a year. That's how far we've come when it comes to PrEP. Dr. Anu, thank you very much.
Thanks for having me, as usual.
Well, it's always a pleasure. That is going to do it for this Plus Talk. What'd you think? Leave a comment below, let us know. And remember, you can like, follow, and share. We're across all your favorite socials at Plus Life Media. And check out our website, pluslifemedia.com. There's all kinds of great stuff on there. And if you want to see this conversation in its entirety or other Plus Talk episodes, check out our YouTube page at Plus Life Official. They are all there. And as Dr. Anu said, don't wait until you're broken. If you've got something now that can keep you healthy and safe and going, go for it. Until next time, bye-bye.